Hi everyone, this is Dr. Adanna Ikedilo coming to you at the end of my day to go over a few things that are important. Well, there's a lot of misconceptions out there regarding your gynecologic exam, and one of that really is surrounding the speculum and what we use to do your examination. So speculums are required for us to visualize the internal vaginal tissue. So we use it to open the area so we're able to see your walls, but also visualize things like your cervix. It also allows us to see the walls and how the tissue structure is, if you have good support for people whose bladder has fallen, whose rectum has fallen, or whose uterus has fallen. So we use it pretty much as a way to have a good visualization. So if at the start of the examination you're feeling pinching, you're feeling intense pain, then please do not bear through it. Let the doctor know, because you can have an alternative that can make this examination a lot more comfortable. So I brought here some of the stuff that I have in my office so I can show you different options. I'm gonna hide it as I bring it out, and ta-da! Look at that. That's big, right? It's one of the wider speculums that we have for examination. I'll bring it as a close-up so you can see. That's pretty big. But when you insert it, this is what we can see. As it goes in, we can see even more. So this allows us to see quite a bit of stuff. But it's not suitable for all patients. And definitely this is not what we use all the time. And we definitely don't reach for this. Most people won't. Okay. Now, saying that, I don't think everyone realizes that there are even smaller speculums that are used in special circumstances. Is that there are different options, and I will show you my favorite. Ta-da! Okay, I'm gonna open this. Now, this is a version of the pediatric speculum. Not too sure if you can see this. It is a very slim speculum that goes into the vaginal area very comfortably with minimal effort and pressure, so makes the exam extremely comfortable. And if I was to tell you that there's an even smaller version of this, so there are many different versions, what we will use for your exam to keep you from having a routine examination as part of your wellness screening that will enable us to identify any abnormalities that, when taken care of early on, prevents harm later on in your future. So, coming to you at the ending of my day just to review these things, because, if you don't know, you don't know. And now you know. We have options. You have options.